Good morning, good afternoon, good evening. Depends on when you are watching this video of mine. I really want to talk on the continuation of my topic, psychology of drug abuse and addiction. Today we want to go into common substances of abuse. Yes, I want to really follow the normal routine for classification of drug of abuse or addictions or substance of abuse or substance of addiction based on how it is being classified according to NDLA 2020. Yes, drug has been classified into three major classes. One, we have socially acceptable drugs. We have the second, which is highly prohibited drugs, and the other class of drug abuse classification is prescription drugs. What are socially acceptable drugs? Socially acceptable drugs are those drugs that, though they can change the body chemistry. Based on my previous lecture, which I said that drugs or toxin is anything that, if being taken into the system, will automatically affect the body mechanism. They are socially acceptable, yes, but they are also destructive in nature. They can affect the organs, they can affect the body system, they can affect the cells, they can affect the neurons, even almost yourself. Because according to Gesture, they say that before a will be formed, there must be some other aspect, the components of that particular individual that will make the individual to be configured or become a form. So now we have what we call the cell, we have what we call the tissue, we have system, we have the organ. Before we can talk about the cell, tissue, organ, system, before the individual, the organism itself, and this is what makes you, what makes you as an entity. When any of these parts of yours is affected, my brother, you are deteriorated. Okay, what are the drugs that are classified under socially acceptable drugs? One, cigarettes. Some people call it nicotine. Yes, it comes in so many, but I know how it is. Yes, it is also obvious and written behind each tablet that smokers are liable to die young by Ministry of Health. It's a Federal Ministry of Health of Nigeria advice that smokers are liable to die young. That is to tell you that there is no good thing that will come out of smoking. The second, again, is caffeinated products or substances. Like, for instance, we talk about kola nuts. Kola nut is a socially acceptable drug. When you have a visitor, you can tell the visitor that you have kola nut. Use it to entertain your visitors, yes. But this drug is destructive in your system. What of the worst of it all is alcohol. Can be in a form of spirit, can be in a form of beer. This is a drug because when taken in a high level or a high dose, it can really affect the system, can affect the individual behavior. However, but they are socially acceptable. We still have things like other caffeinated products like normal caffeine, raw caffeine that come from the cocoa. They are also drugs of what? Abuse. But they are under socially acceptable drugs. Then let me just rush back and go forward because I don't want to delay this video. The next one is highly prohibited drugs. Highly prohibited drugs are those drugs that, when held by the government of that particular area, the individual will face a prosecution in some area like Turkey, like let me say Saudi Arabia. When they see with those drugs, they behead you, they kill you, they by hanging. Here in Nigeria, we take the person, and if the person is an addict, we rehabilitate the person. If the person is a dealer, the law or the competent law of jurisdiction will take part in that. So I still want to emphasize in the area of those drugs that are classified in this region. One, they are called the inhalants. Inhalants, they are drugs that can easily be inhaled. Yes, not that because they're here, they cannot also be injected or be absorbed in the system. But for instance, what an example of inhaler, we have what we call amphetamine. Amphetamine can be inhaled, can also be taken like a normal tablet. But the methamphetamine of it is an inhalable substance. Then we still talk about another drug called marijuana. Marijuana is a leaf that is in fact is a form of a gas that are being found in different areas. So depends on the area where marijuana is being produced and how it is found and the kind of the product gives a different brand. Then we have brands of marijuana. We have things they call the Arizona product of marijuana. We have the normal Igbo, which is called the India hemp of Nigeria. We have some people call it other sweet names like ash. Some people call it other things. We still have what we call the loud, yes, amnesia. All these things they are products of what marijuana, and this is also under drugs of what prohibition. Then not only that, we have cocaine, a product come from the opioid tree. This cocaine is another drug that has a fast effect on the nervous system, so it can easily affect the body also. Hence, if caught by the legal aspect of that particular country, let me say the police, they are going to face the law. It's not done. It's not only that. We still have another drugs again, heroin and so on. So let me rush this topic. Another drugs again under classification according to Delhi is prohibition prescription drugs. There are some drugs that are controlled drugs. These drugs they are only prescribed by a competent medical practitioner. If not prescribed by competent medical practitioner, that means the drug have gone into abuse. For instance, we have drugs like amphetamine. Amphetamine, not the meth. The meth, which is not a recreational drugs, is the one that is highly prohibited. But they is the other hand, yes, but the prescription aspect of it is amphetamine that come in form of Adderall, Benadryl, and Ritalin, which is used in treatment of ADHD, attention deficit hyperactivity disorder, can also be used in treatment of things like obesity. What about hangover? And then this you can use it in treatment of that. If it's someone that's having narcolepsy, excessive daytime sleeping, you can use amphetamine to treat it. So these are drugs that are prescribed. We still have things like diazepam. Under benzodiazepine group, we have benzodiazepine, for instance, the rofinol. We have the diazepam, D10, D5. These are drugs that, if taken in the system, the individual can also get that reward of feeling of calmness. Hence, the possibility of being addicted to this drug is there, but they are classified under prescription drug because they can also be used in treatment of minor ailments. We still have TCA, which is tricyclic antidepressant. This tricyclic antidepressant, they are drugs that is used in treatment of depression. These drugs are easily addictive also, like triptizol of it. They can also be drugs of abuse or addiction, but they are prescribed. What about another one called pentazocine? Pentazocine is a drug that is used in treatment of painful case. Let me, for instance, somebody have a musculoskeletal pain. Sometimes we give it to a pregnancy pain. Somebody have it, we can also give it to somebody that have dental pain or any kind of pain, just to relieve pain. But that individual can be addicted to it. We still have things like tramadol. Tramadol is a drug that its end product is called tramadol. This tramadol group is the absorbable aspect of tramadol, but if not absorbed, if you don't have a particular enzyme called CPCY, then this particular drug will never be absorbed in your system. Hence, it will be as it is, then to affect your system, or you can react to it and it will deteriorate your body. But it is a prescription drug, usually for pain, though the dose is what is more important. The normal prescribed dose is 50 milligrams. Then if the pain is high, you can increase to 100, but the addicts take up to 250 milligrams and above. Some people take a full tablet of tramadol. We still have other drugs that are under prescription. We have drugs like people abuse some anesthetic medication. Yes, I know propofol, people abuse it. I know so many drugs that people abuse, but they are under controlled drugs or drugs of prescription. So these are lists of drugs that can easily be what abused or addicted based on NDLA classification. Thank you. I'm still your resource person, Don Wokike. Please make sure you click the red button and follow up all my video as I'm uploading them one after the other. Thank you and God bless you. Bye.